Hello, students, and welcome to week 7 on Child Health PHS 311. Last week we looked at topic 6, where we discussed integrated management of childhood illnesses. We saw reasons why there is integration of childhood illnesses in its management, and then we saw the objective of that strategy. So this week we are going to look at growth monitoring. At the end of this lesson, we should understand what growth monitoring concept is, and then know how to involve ourselves in what we call nutritional assessment methods and see what we can learn from it. So, what is the concept of growth? When we talk about growth in children, remember in our previous class we talked about the difference between growth and development. Growth is increase in size, but development is changes in the cognitive skills and other skills a child has. That is what we call development. So we'll look at what concept of growth is, because growth has a role to play in the development of a child. So when we talk about growth, it's usually a continuous process from when a child is conceived, and then when a child is born gradually to physical maturity. There's always what we call a normal growth whenever the nutrition a child takes is right, and the child is also in a good environment for that age. These conditions are usually satisfied. If they are satisfied, it ensures that growth rate is the same for a well-nourished and healthy child. So when children are usually growing, they become taller, they become fatter, they become heavier, and they grow out of their clothes. These are terms we use to express growth. So what are the factors influencing growth monitoring? Normally, when a child is growing and when we monitor such a child, there are factors we look out for that could affect growth monitoring, and that has to do with the family genes. The genes, the makeup of such a child that the child inherited from the family determines the growth pattern of that child, and the height which the child attains as an adult. Also, when you look at what we call other extraneous factors, like the environmental factors, like whether the child is taking good nutrition, diseases in the environment where the child lives, whether infectious diseases, then you talk about other diseases or other things that can affect metabolic conditions that can affect the child, like the endocrine conditions, the hormones such as growth hormone in such child, whether it's deficient or there's a disease of the pituitary gland. Then you have some other systemic diseases like diabetes mellitus. Then you have some other extraneous factors like stress in the environment where the child is growing up, and then abuse. Child abuse can also affect or influence growth monitoring in such a child. Another thing to look out for is usually in every environment, in every community, in every population, in every country, every ethnic group, there are factors that actually, that play a role, interplay of factors that play a role in the development of what we call a reference range for either weight or height for different age groups and different ethnic groups. So the trend over time based on race, ethnicity, and some genetic makeup versus the food people eat, their attitude, and the environment where they live affects the international reference range for weight, height, and all that in different populations. Also, the local reference range is also determined by the ethnic group. Like in Nigeria, you have different ethnic groups. The weight and height in different ethnic groups may not be different because they live in different environments, they eat different food, so all these, and they have different genetic makeup, so that might affect the reference ranges in all these. And then when you're measuring weight and height, you could measure it one at a time, you could measure it over time, what we call dynamic measurements. So why is growth monitoring important? Why do we have to monitor growth? It is important because growth is a very sensitive measure of health. When someone grows, you can tell whether the person is healthy or not, especially for a child. When someone gains weight, it's also a sensitive measure of growth. When a child gains weight, it's a measure of growth, and growth in itself is a measure of health. So when a child begins to falter in growth, it begins to give concerns. So growth faltering is one of the best indicators for early detection of health problems in a child, such as nutritional and infectious of origin. It can identify steady growth, which is usually the best indicator of a child's health. So these are reasons why, or some of the reasons why it's important to engage in growth monitoring of a child to detect these things. When you follow up a child over time during growth monitoring, you're able to catch up some of these problems a child has. It also tells the nutritional status of a given community. When many kids or many children in an environment are not healthy, they are faltering in growth, it gives you a picture of the nutritional status of people in that community. The essence of that is also to identify malnutrition on time before it affects the brain. So when is the best time to start growth monitoring of a child? First 5 years, of course, is very crucial in the development of any child, especially brain development, which is almost completed at age 2. So it is important that you start to monitor children before that age. Malnutrition peaks at around 24 months of age. So it is important, like I said, that early intervention with regards the health of a child, nutrition, cognitive stimulation, and socialization programs are started early enough. So less than 5 years is the adequate time when a child is less than 5 years, at 0 to 5 years, or 1 month of age, or 1 day of age to 5 years. That is when it is important to start growth monitoring. So what is growth charts? What do we understand as growth chart? A chart is very important record which is used as a personal growth chart for the child, and has a record of that child's illness, and it shows the progress of that child. It has notes about the nutrition advice given to mother and how mother are recording all that. It tells the direction of that growth of that child and reveals also significant change in the growth pattern. So that helps in detecting early enough if there is anything like growth failure in that child. This brings us to the growth curve. From growth charts during growth monitoring, that brings about growth curve. So when you have taken regular measurements and recorded that of the weight and the height of that child, you plot that in a graphic way. That graphic depiction of different weights or heights you have taken of that child as the child is growing at different period gives you the growth curve. So when you weigh the child, it's not just a problem, but you have regular and accurate plotting of the different weights you have taken over time. So that curve shows whether there is, an increase, an upward curve of in a graph, or an upward trend in such a graph. It shows that that child is doing well growth wise. So growth chart is essential for every child, just like antenatal care card is for every pregnant mother. It is an important part of health education to teach mothers to keep growth charts carefully. So this brings us to nutritional assessment methods. When we talk about assessing children nutritionally, it's usually that nutritional assessment is a vital method for monitoring growth. And we have three basic methods for nutritional assessment. We have the clinical history and examination, which is done by physicians to find out in the hospital if a child is growing. Then we have the nutritional anthropometry, and we have the biomedical and laboratory tests, which are done by scientists in the lab. The key one that is important to you as a public health expert, which you can deploy in nutritional assessment research, is nutritional anthropometry. So what are the things in nutritional anthropometric method? Is an indicator of malnutrition. Some of them can be indicators of acute malnutrition. Some can be indicators of chronic malnutrition. The most important components of this anthropometry is the weight, the height, the mid-arm circumference, and the head circumference and the chest circumference. These are the important parts of measurements that you take in a child. But you need to compare each indicator with another indicator by looking at either weight for height, or what we call weight for height, weight for age, or height for age. That is if the age of such a child is known. Then you have the mid-arm circumference, and you can also compare the head and the chest circumference. So these are indicators, like I said, what you measure, and when you compare it with the standard or the international or local standard, that can tell you whether such a child is actually malnourished or chronically malnourished, and the growth pattern of such a child. So in summary, we've learned growth monitoring concepts. We now know the different methods of nutritional assessment. In our next lecture, we will look at the right of the child. Thank you for listening.